Well, the next procedure that we're going to talk about as far as the cosmetic procedures is if patients have the exact opposite. That means they don't have too short teeth because of a gummy smile, but they have too long of a teeth because of gum recession.
Okay, okay.
And so this is an example of a young female patient. She was 24 years old, and she basically had...
So on the two, like canine teeth?
Yes.
They were receded?
Yes, you can see here that she had on the canines and on the premolars, which are the bicuspids on the corners of her mouth, basically she had receding gums. And you may look at this from a social distance and say, well, this is not that bad of a smile. But for this patient, it was not only a matter of the smile not being attractive because she showed these long teeth in the back. Remember, she's just 24 years old.
Okay.
But also the fact that these teeth had a lot of sensitivity. That means every time she would drink cold liquid, and here in Texas, obviously, everywhere you go to a restaurant, you get served large drinks with a lot of ice in it.
Okay.
So she could not really drink that to that extent.
So receding gums, and for those people that maybe don't have cold sensitivity, that's where they're headed.
Yes.
Because you're exposing the root.
Absolutely. You're exposing. Receding gums, obviously, at the end will lead to tooth loss once they get past beyond a certain point.
So you want to get in there and do something.
So yes, you want to address this situation as soon as possible, because not only do the gums recede and become more sensitive, they're unattractive, but also they're more prone to cavity development on the root surface.
So how do you do it? I mean, what do you do to do that? You transplant gum tissue? What do you do?
Yes. In these type of cases, what we do something basically gum grafting. Okay. And gum grafting can be done in a variety of ways. The majority of patients these days, we use a gum graft that we don't harvest from their own mouth. We used to go to the patient's palate to get gum tissue to use this for a transplant. But nowadays, we actually use tissue bank tissue, and that not only gives us the option of doing multiple recessions in one setting, but it's also much more comfortable to patients. And actually, the color match of the tissue bank tissue is much, much better than the one if you use your own tissue.
Yeah, I mean, you can't, in this after, very nice, you can't tell any discoloration.
No, in this case, if it's done properly, and that's the other thing where the training and expertise kind of comes in, and this is what we teach in our courses as well, is that these procedures are done very minimally invasive. We do not just go in and make a big incision, because that's when you end up with scar tissue and tissue unevennesses that then catch the eye. Okay. So we actually, as thin as these procedures, as these tissues are, and as fine as these are, we actually tunnel underneath these procedures. And it is an aspect of our specialty which I call periodontal plastic surgery.
Is that
so
right?
It's the plastic surgery subdivision of our specialty.